Have you found that over quite a short period of time, your faces really age a lot faster? Well, often the menopause is a very significant factor for women that can really result in accelerated aging. And 80 to 90% of all my patients are women, and many with facial aging have really noticed changes that have really accelerated at the round of menopause. Well, menopause is a natural biological process marking the end of your menstrual cycle. So typically it occurs in women between the ages of their late 40s and early 50s. However, it can actually occur much earlier than that, and it's called early menopause. And what happens is there's suddenly a significant decline in your female hormones, your estrogen, your progesterone. These hormones drop in terms of the quantity the body produces, and both these hormones play a crucial role in maintaining skin health. They result in dryness, they result in loss of elasticity, thinning of the skin, which results in more wrinkles and lines, and essentially menopause accelerates the aging process, making your skin appear older much quicker. And it's estimated from some scientific studies that up to 30% of skin collagen is lost during the first 5 years of menopause. That's pretty shocking, and because collagen is the protein that gives structure, elasticity to your skin. And so during menopause, if there's a decline in estrogen, that dramatically results in a drop in collagen production, and this loss results in the skin becoming thinner, become less firm, sagging, and the formation of more wrinkles. So think of collagen really like as the scaffolding in your skin. Well, managing the skin dryness and thinning during menopause is kind of key. Often women find that during menopause the skin becomes drier, and the reason for this is this drop in estrogen, and your ability of your skin to maintain moisture diminishes, and this results in dryness, making the skin feel rougher and also has a kind of dull complexion. Now, as the skin becomes thinner, it's also more susceptible to damage and aging signs. Now, one way of looking at this is your skin, you can think of it as a sponge. Now, when it's well hydrated, it's plump, it's smooth, but as it loses moisture, it shrinks, it cracks, and that's similar to what happens in terms of your skin during menopause. Now, how can you take measures to improve your skin hydration to maintain that kind of more youthful appearance? So one thing that's worth discussing is hormone replacement treatment, HRT. Now, HRT can be an answer to slowing down some of the changes in menopause. Now, HRT is not necessarily available or advised for every woman. However, in some people, by supplementing some of those lost estrogen and progesterone with supplementation, it can maintain your skin and your body's kind of vitality for longer, because it's restoring some of those lost hormones, alleviating the menopausal symptoms. Now, HRT can improve skin elasticity, skin thickness, moisture retention, and essentially it's slowing down the aging process, helping you to maintain a more youthful appearance. So topical treatments can be used to combat some of the changes that occur with menopause. So one such product is retinoids. Now, retinoids are products that effectively boost the skin collagen because they promote cell turnover, and that reduces wrinkles and improves fine lines and skin texture. And these are a very effective way of improving skin quality. However, if you have more sensitive skin, you may find you need to start with a much lower concentration. You may need to start with using them every other day or every 2 days initially, and gradually you build up your tolerance to the skin product. Now, hyaluronic acid exists naturally in your skin. It's another essential ingredient of skin, and we know that some of that is lost with time, and it's a powerful hydrator that can plump up the skin and reduce the appearance of fine lines. Now, peptides are also a beneficial way of stimulating collagen production and repairing the skin. Now, there are different ways that hyaluronic acid can be introduced in the skin. It can be done topically, but more powerfully with injecting hyaluronic acid in the skin. The other element that's very important to discuss is sun protection factor, because you accumulate sun damage in the skin, and that results in damage into the skin layers. Now, a good SPF factor such as 30 or 50, it's necessary to apply this even every 2 to 3 hours if you're in a lot of sun, but that will preserve aging of the skin. And what oral supplements can you use to help your skin quality during the menopause? So vitamin D, well, is an absolute must in maintaining bone health, in terms of maintaining skin soft tissue strength, because it is a pivotal element that is necessary for maintaining strength in these soft tissues and bone. So taking vitamin D supplements is of importance. The other factor that's become more prevalent over the last few years is oral collagen supplements. Now, oral collagen supplements improve skin elasticity, improve hydration, improve wound healing, and they improve the texture of the skin. And there are, I personally I'm vegan and I don't eat any animal products, and there are vegan collagen supplements that are available. Many of the collagen supplements are also based on fish or animal products, but definitely there is good science behind these improving skin quality. Now, the other element is omega-3 and omega-6, which these are fatty acids that act as a barrier for the skin, and they reduce inflammation and damage caused by inflammation. And so in terms of what non-surgical procedures, products can you use that will improve skin quality and changes around the menopause? Well, certainly Botox can make a really significant difference. And as your skin can thin during menopause, classically, you can notice more dynamic, fine lines with movement. And the three classical areas are between the brows, like frown lines, sometimes called number 11s, crow's feet when smiling at the corner of the eyes, and of course these horizontal lines on your forehead from lifting the brows. Now, all these lines can be really effectively treated with Botox, because Botox reduces the movement in those areas, and it works very well for these lines. Now, it won't do anything to kind of improve the skin long term, but it reduces those lines by reducing movement. Dermal fillers, well, dermal fillers over the last 10 years there's been a massive increase in the use of dermal fillers because a clever pharmaceutical company worked out how to manufacture hyaluronic acid. Hyaluronic acid exists naturally in the skin and in joints, and we know it gets lost with time and aging and menopause. So by restoring some of that volume, it resulted in much more youthful appearance by hydrating those areas and adding more volume. Of course, consideration has to be given to the amount, because less is definitely more. Like modest or small amounts of dermal fillers look natural, they look beautiful, they look elegant. However, too much, it gives a round appearance, puffiness, pillow face appearance, and those things are definitely not what we're looking for. We're looking for natural improvement. And then of course we've got skin hydration techniques where hyaluronic acid can be used to inject into the skin, and that could be in the form of mesotherapy, Profilo, and other treatments. And these definitely make a difference because it hydrates and plumps up the skin where it's thinned down during the menopause period. But when it comes to things like skin resurfacing, such as peels, such as lasers, well, these really do have a recovery time. A very, very superficial peel is going to have next day recovery, but you're not going to see much of a difference. A more powerful treatment, like the gold standard, would be a CO2 laser. I have an advanced CO2 laser that smooths over the superficial skin. It works on deeper layers of the skin, stimulating collagen. And that combination, well, it absolutely rejuvenates the skin. However, there's a recovery, and that recovery is relatively short, a matter of days. However, there is a recovery associated with it because it's stimulating collagen within the skin. Now, microneedling techniques, well, these are nice because these are techniques that definitely make a difference. And what it is like a roller or a machine that has tiny little fine needles that can stimulate natural collagen, boosting collagen production, improving texture, improving tone of the skin, and just smoothing the skin over. Now, there's also this group of non-surgical devices that tighten skin. Now, these often promise a lot and they deliver a little. They definitely have a role because they do tighten the skin, but really we're talking millimeters. Now these devices such as radio frequency, a common brand would be Morpheus 8, and there are other treatments as well that work on the same principle of radio frequency. There's also like Ulthera, like ultrasound tightening, there's heat tightening, there's cool tightening. All of these technologies work on tightening the skin millimeters, so they don't penetrate the skin except for a very superficial amount. Now it's important that expectations are modest with these treatments, and because if you're expecting it to lift a centimeter of loose skin, that's where you're going to be disappointed. Now they definitely have a role, particularly with milder changes from the menopause. They do improve skin, they do tighten it, but their effects are quite limited because they're not going to tighten huge amounts. When it comes to healthy habits for glowing skin, well, there are a number of things that are important. Now, a balanced diet, and particularly a diet that is rich in antioxidants, rich in vitamins, minerals, these really support skin health. And these tend to be diets that really favor vegetables, fruits. They tend to be more vegetarian and vegan diets. Berries, nuts, these kind of things. Now, that's true that some animal products like fatty fish are excellent choices because it has omega and fatty acids within it. For a number of years now, I've been vegan, and I've noticed a significant difference in my health, in my skin quality. And I'm not suggesting that everyone becomes vegan, but definitely having a diet that is more favorable to that kind of nutrition is favorable because it improves your skin quality. Now the other element is like being well hydrated. It's so important to drink plenty of water every day. Most people get dehydrated every day, and what water does, well, 80% of us is water, and water hydration maintains skin moisture, skin elasticity. It improves also your general health. Now in terms of like exercise, well, regular exercise improves circulation, it nourishes skin cells, and it keeps them healthy. These things are very important for maintaining your health, not just your skin quality and facial aging, but your health over the menopause. There is a point where there's so much changes that have occurred, partly through menopause and a thinning of the skin, partly through natural aging, a combination of these two, that you notice loose skin. And the first area that many patients notice this is around the eyes. Loose skin, drooping, and a common procedure that I do for my patients every day is blepharoplasty, reshaping the eyelids. And good blepharoplasty will rejuvenate that eyelid appearance, often by taking away some of the loose skin, hiding the scars in natural curves, but often we need to do a little bit more. We need to add a little bit of volume, we need to do a little bit of skin resurfacing, we can use a little bit of regenerative medicine to improve the skin quality, but what all these things are doing is reversing some of those changes that have occurred through the aging process associated with menopause. Now there is also like a common thing that many patients notice, which is more changes along the jawline, laxity. You can pinch like a centimeter or more of loose skin, changes in the neck, and really this is because menopause has caused a loss of collagen that has resulted in more gravity and everything sagging down and looser skin. Now if there's more change in this area and there's deeper lines like nasolabial lines, marionette lines, the only current treatment that really improves this is a vertical deep plane facelift, and that's a technique that I've customized over working in this area for more than 10 years, in that it restores the anatomy where it used to be. And currently, while a lot of facelift is done like in front of the ears, which does make a difference, it does take away loose skin, but because it doesn't lift vertically this area, it doesn't give quite the same natural or long-lasting result. But if you've got more than a centimeter of loose skin, it's really a vertical deep plane facelift that's going to make a big difference, make you look 10, 15 years more youthful. Many patients try the non-surgical devices, radio frequency, and all of the devices that I mentioned. Often they're disappointed because those will tighten like a millimeter or a few millimeters, but they're not going to make a difference if you've got more significant changes. All these things have to be customized to you. Like everyone's face changes a little bit uniquely with time, and so any procedure has to be customized to you. I personally ask all my patients to bring an old photograph to see exactly how your face has changed, because then we can really look at the detail. But often to get the very best results, we also have to add a few other things in. Fat transfer. Because our face, our skin loses some of our natural volume with time, if we take a little bit of fat from around your belly button, we concentrate that fat and put tiny amounts into areas that the volume's been lost, it will give a more youthful appearance because it will smoothen out wrinkles and lines and shadows and restore some of your natural volume. Often, because within your fat there are regenerative cells, which are not true stem cells, but they have some of their properties, those regenerative cells really improve the skin quality. They make your skin smoother and more even. So particularly if you've got changes like thinning of the skin with menopause, it will actually reverse some of those changes. Another consideration is aging the skin, like fine lines, pore size, sun damage, and pigmentation of the skin, which is kind of accumulated with time. Well, skin resurfacing, such as CO2 laser, will polish the skin. It will smoothen out the fine lines and wrinkles. You're combining it with radio frequency that will tighten the skin just beneath the skin, 2 to 4 millimeters. And using regenerative medicine to improve the skin quality. These treatments will improve the skin texture, reduce pigmentation, stimulate collagen, and rejuvenate your skin. Now, often to get the very best natural results, we need to combine these treatments in order to get the very best results to reverse those signs of aging. I do hope this information has been helpful for you. It's been great discussing menopause and the changes that occurs with it. And if you have any other thoughts or questions, please don't hesitate to contact me. I have many discussions with my patients regarding these changes and what can be done to improve them. Many thanks for watching.